So we are back now with the same information. We are going now to focus on the occlusion. The analysis of the occlusion is very, very large, very wide, but we are going to focus in one point, in the 6 keys of ideal occlusion, of normal occlusion, if you want. Before we had the 6 keys of ideal occlusion, we didn't have enough information to what seek for in our treatment. We have just the class 1, 2, or 3 from angle. From angle's perspective, the first upper molar was a key in establishing the problem. Now, after the 1970s, after Andrew's studies, we had now the opportunity to see everything in a wider way, like more complete, more thorough way. And we are going to focus on that. And as you know, I'm extremely clinical. And in each point of this analysis, I'm going to link with the treatment planning. Because for me, the most important thing is not just about understanding the problem. It's about understanding the problem and linking it to what we want to do. I hope in the end of our course, you're going to see everything the way I see. At the end of this course, I'm going to give some exercises, some cases to be treated, to be planned, and you are going to, with me step by step using this protocol, and I'm very sure that you're going to apply this in your daily practice, seeing everything like I see. In my cases, in my office, when I treat patient, when I see the case, I go this way. I thought about it before. I thought about this before. We go from the face, then we go from the occlusional analysis, smile, and everything's going to make sense for us because we're going to see in a big screen and we're going to practice what we see in the big screen, doing this protocol, establishing what is wrong, and linking what is wrong with the treatment planning. What are the solutions for each situation? And we're having this path to follow. We're having this sequence and the hierarchy of our treatment planning. And this is what makes sense for me when I see everything and I put all together. And if it makes sense for me, it will be probably the same thing for you. It will make sense for you. Let's go. Let's move on. So we are going to occlusional analysis now, linking the 6 keys of malocclusion to the treatment planning. But first, we need to recognize the problem. We have the sagittal relationship is one of the most important things or most important aspects that are the most difficult to treat. Because we now need to understand the problem, the magnitude of the problem, and what are our alternatives when we have this. We have some parameters that we need to pay attention to. In the molars, for example, we have three parameters to pay attention. The angles class 1, the first parameter and the most simple of them is the mesiobuccal cusp of the maxillary first molar settling in the buccal groove of the mandibular first molar between the mesiobuccal and midbuccal cusps. So this is simple. This is very common to see. And probably most of the orthodontists that I know, they will follow this kind of malocclusion, this kind of analysis of the occlusion, paying attention to this point. But is this really important for us? Is this really the most important point regarding the sagittal relationship, meaning class 1, class 2, or class 3 cases just based on the molar? I don't think so, because you're going to see that for Engel's perspective, from Engel's perspective, this is just the situation that established what he wanted to treat, class 1 in this condition. But when we just pay attention to this point, to this specific point here, this is not very important, and this is not going to allow us to position the premolars and canines in a proper situation, a proper relationship. I'm going to show you why. Let's go on. Let's move on. So this is what we know as angles from Engel's perspective. This is the class 1 from angle. And we have now a different analysis, a different thing, the different point to pay attention. And you're going to see that this is more important than the previous point. The distal marginal ridge of the upper second molar settling in the mesial marginal ridge of the second lower molar. I'm so sorry. The distal marginal ridge of the first upper molar settling in the mesial marginal ridge of the second lower molar. This is important because when we have this angulation, we can position the first and second premolar in a better position. Let's see here. Can you see what's going on here? If we are paying attention to this condition, the previous analysis that we gave, you may look at this position here and think, well, this is a class 1. And if I think this is a class 1, what is this here? This is not a class 1. This is a class 2 condition for the premolars. And this class 2 here, in the second and first premolars, they don't allow the canine to settle in its right position. And this is bad. So if I just paid attention to this condition here, the mesial cusp of the upper molar settling in this groove here, I would think, well, I have a class 1. And I don't. So what's wrong here? What would I seek for here to establish a better condition to the premolars and the canine? This is something that I pay a lot of attention because I understand that when I have this angulation of the first upper molar, and that's why most of the prescriptions that we see and we use, they have this angulation for finishing the case in class 1. But pay attention. For finishing the case in class 1. And this is important. I'm going to show you why. Let's move on. So here we have a class 1 from angles perspective, but we don't have a class 1 in premolars and canines. Why is that? Because we have the upper first molar in an uprighted position. And we need the upper first molar to be a little bit more angulated. Why is that? Because it allows the first and the second premolar and also the canine to go forward and settle in a better situation, a better condition in relation to the cusp groove, a condition that we seek for, that we need. And here we have it. So when we go this way, you see here, we allow the upper second and first and premolar and the cusp to settle in a better condition, in a better relationship. So we need this angulation. We need this angulation. When I go to treat this kind of patient, when I treat class 2 cases, I always look at this condition. This condition, this contact between upper marginal ridge or the distal marginal ridge of the first molar contacting the lower mesial marginal ridge of the second molar. Like this here. Let me show it to you more closely. Can you see it here? We have this contact. We have this contact here between upper and lower marginal ridges. Distal, first molar, mesial, second molar marginal ridges. It's important, it's beautiful, and allows for this condition of intercuspation that we need. Okay, so always pay attention. But this is just for class 1 situations, meaning when I finish my case in a class 1, molar class 1, this is what I need. But sometimes I don't have this. Why is that? Because I'm finishing my case in a full step class 2. When does this happen? It will happen when we extract upper bicusp, first or second, or, for example, when I close the space of a missing lateral incisor, congenital missing lateral incisor, and I close the space, substituting the canine in position of the lateral, the first premolar in the position of the canine, so I will have just one premolar in each hemiarch. In this case, I will finish my case in a solid class 2 condition in the molar. So we have a full step molar class 2. And in this case, I don't need this angulation. It's quite the opposite. I don't want it to happen because if I have this, I will have a difficulty to settle the cusp of the second and first premolars because they will be higher, because the upper first molar is going to disocclude the anterior teeth in relation to them, the first molar, and make it very difficult to go with this settling, this intercuspation. So this is important for a class 1 finishing, not for a class 2. And this is another thing that we need to pay attention. When we are going to finish in a class 2 situation, we need to choose the right tube for that. We don't want to the upper molar to be angulated nor rotated. So we need to establish since the beginning that this is the condition that we are going to finish the upper first molar and second molar. Meaning, I don't want actually the tube to be a class 1 tube. I just need the torque, the inclination, but I don't need rotation and or the angulation of the molar, okay? So the molar relationship described by Andrews assumes that the maxillary molars present a greater angulation. 5 degrees, 10 degrees of angulation is what we need. Of course, we're going to deal with this choosing the right angulation from case to case. It's individual, okay? And here we have it. So it allows us to have a better intercuspation of premolars and canines. And this angulation is very good, very beautiful, and allows that to happen. So this is the first condition. When we compare here the angulation of 5 to 10 degrees of the first molar with no angulation or a very low angulation in this the left example here, we see that even though we have the cusp groove relationship, we don't have the intercuspation of premolars. And here we do. Why is that? Because we have this 5 to 10 degree angulation of the first and second molars, allowing to the intercuspation of the premolars to be a better intercuspation. So this is the first topic that I want to address with you. The intercuspation of the molar is very important, and the angulation for allowing the other teeth intercuspation in the anterior segment from premolar on, from premolar forward. So this is what I do since the beginning when I finish in a class 1 relationship. Meaning sometimes I don't finish in a class 1 relationship. When is that? When we do that? When we have extraction of bicusp or substitution of the lateral incisor from the canines, and the canines for the premolars substituting the canines. In this case, we will have, in fact, only one premolar in each side, and the canines are going to be substituted by the premolars. So this is something that we need to pay attention, and we need to program and to plan since the beginning. So we are going to have now all those informations, and at the end of our course, we are going to put all together, and all is going to make sense. All those information together are going to make us have more condition to establish the better treatment planning. You know, this is the course that makes me more excited about, because I did better treatments and I was more confident with my treatments when I established that I needed to understand since the beginning all the aspects that involve the malocclusion, facially speaking, cephalometrically speaking, and occlusally also, in the smile, and put everything together in a protocol, in a sequence of importance, and establishing problem, solution. And from then, we have our treatment planning in a table that makes sense for us. And you see in the examples that I'm going to give at the end of our course that everything makes sense. And we need to see things like this. I don't understand people just using the records of their patient, cephalometrics, panoramic X-rays, and photographs, and have all this information in their hands and don't use them. Because when we use them this way, we see clearly everything that we are going to do during our treatment. Believe me, this is pure gold. Pure gold. Okay? So see you soon, guys. Bye-bye.